364, serving the community, 102.5 EAVA FM.
Welcome and good evening to another slice right here on EAVA FM, the Caribbean show. This is the first part of the show where we're going to be talking to the NHS about this big project to do with building better hospitals. And I am joined tonight with Veej. How you doing, Veej?
What's good, Attraction?
Everything's fine, man. You know,
we're back here. I'm back on your show.
Yeah, obviously, we need to get the word out there and let everybody knows what's happening with these improvements and what they've got. The NHS has got program for the future for our hospitals.
Oh yes, absolutely. So as the listeners may be aware, the NHS have made some proposals, £450 million. We last met Attraction on your show, and the NHS staff couldn't make it due to they had an event, something that came up very important. But today we're being joined by Mark, who is the director of strategy and communication from the NHS.
Right.
So he's joining us to answer all the questions that all the listeners had, and it's going to be fantastic because I think this is really going to kind of let the listeners know what the NHS has proposed, and we can get everyone to kind of fill out the questionnaire. Right?
Yeah. You know what? It's kind of good because the feedback out there, there's quite a few people have been asking me, because I've been handing out some of these leaflets. And then when they open it, they're like, wow, we didn't realize it was such a big project.
Yes.
You know what I mean?
It's huge, right?
And there's a lot of people still finding out what's actually, up to today, I was talking to someone and they didn't even know this was going on.
Okay.
You know what I mean?
Okay.
But through the radio station, they're getting to know.
This is why we really, we're good at what we do in terms of Attraction. I know you've been spreading the message so much more, and it's really about getting the message out there because we really hit them hard to reach communities, and it's great for us to kind of get people to kind of they love your show.
Yeah.
And I know it's really important that the things you're doing as well, like the community, all the aspects you're pushing.
Well, this is what it's about, it's about getting the community involved because obviously this is going to affect everybody in Leicester because there was big changes.
Yeah.
I mean, the hospitals have been there for quite a long time.
Yeah.
Without any changes. So, and when I go out of town and I see different hospitals and I think, wow, how come our hospitals are not like that? You know what I mean? But, it's a good thing. I think it's a good thing because, we have to embrace change.
Yes, we have to embrace change, and we have to have a voice as well. So on that note, should we bring Mark live on air?
Yes, of course, of course.
Hello, Mark. Can you hear us?
How are you doing, Mark?
I'm very well. How are you?
His microphone on.
Try that again.
Mark, can you hear us?
I can hear you loud and clear. Can you hear me?
Yes, I can.
We can.
Let me just turn you down a bit. Yeah. Sorry, Mark.
Okay. It's great having you back here,
Well, thank you for inviting me back. And I'm sorry I couldn't make it to the one that you mentioned earlier in your intro.
Yeah. And we know because of the pandemic, COVID, there's lots going on. And we really appreciate somebody like yourself to come on the show and speak to the listeners about what's going on, So yeah, thank you again for rebooking with us and coming on the show. It's fantastic.
Yeah. Thank you very much. Right, Mark, the first question I want to ask you is what changes are being proposed?
Okay, to be honest, I think you've done a better job of introducing them than I could, but I'll try not to repeat what you've already said.
Yeah.
So listen, the first thing is we've been at this for about 20 years in terms of trying to get this investment for Leicester.
Okay.
You mentioned that some of our buildings are old and knackered, and you're right. Actually, our oldest building is 252 years old.
Wow!
This year,
I didn't realize it was that.
Oh yeah, and we're still using it for clinical care. So that gives you a sense of that. Most of our buildings actually predate the formation of the NHS.
Yeah.
back in 1948.
Mm-hmm.
So we've been awarded £450 million of government cash to basically fundamentally upgrade the hospitals. And we could not be happier about that, because it means we can do some of our brilliant clinical work, but we can do it out of a better environment that's more akin to modern medicine and modern surgery. And I guess the 3 or 4 big headlines in terms of what we're going to spend that money on are essentially at the Glenfield Hospital, where we do a lot of our respiratory and cardiac work, so hearts and lungs. We're going to build essentially a new hospital alongside the existing hospital.
Okay.
And that new hospital, we're calling it a treatment centre, but we've got to find a better name for it than that, is essentially a kind of a specialist facility where it doesn't matter how busy the rest of the hospitals are in terms of emergency patients, we can still keep going with our elective non-emergency care. Okay. So what normally happens in the NHS is through winter or through pandemic, all those patients who are being listed for perhaps a knee operation or a hip operation or cataract surgery, if we're kind of flooded out with emergencies, they get cancelled at short notice. And this new treatment centre will enable us to protect that work. So even when we're running really hot during winter or through pandemic, maybe there's a wave 3, we can keep that going. That's the first bit of the investment. Second bit, we're creating a new women's hospital, new maternity hospital at the Leicester Royal Infirmary site. So bringing all our maternity units under one roof. That will make it easier to staff, but it also means that mums who are having babies will be able to have their babies in purpose-built modern buildings rather than some of the tired places we're running at the moment.
Yeah.
And it also means our people like our neonatologists, those people who look after the kind of preterm babies, and our obstetricians, those people who look after mums who perhaps need a bit of medical help with their birth. It means those skills are kind of focused in one place and can learn and support one another. And then by no means least, and probably not last actually, we are also creating for the first time a standalone children's hospital. So Leicester's hospitals currently have the biggest children's service in the East Midlands, so bigger than Nottingham, bigger than Derby, but you'd never know it because those services are dotted around our 3 hospitals.
Okay.
We're going to bring them all together into a new standalone building, which we're going to turn into a dedicated children's hospital. And that's really important because at the moment, though our children's services are really rather good, they exist kind of cheek by jowl with our adult services. And hospitals are a bit scary for most of us, but they're especially scary for kids. And so if we can create an environment that is more welcoming for children, looks a bit more like the kind of thing a child would want to see in a hospital, then we hope it's not only a brilliant place to be treated, but somewhere that also puts our younger patients at their ease before their operations.
So why are these changes needed?
Because I know, Mark, you've mentioned quite a lot of reasons, and we've been talking about this. But why now are we going to be moving? Why have you proposed the certain changes you've proposed? Why them changes?
Okay, so a good question, and I guess right at the heart of it goes back to what I was saying about the treatment centre and the separation of our emergency care from our elective care. At the moment, Leicester's really unusual in having a population. This is Leicester, Leicestershire and Rutland. We serve all those areas.
Okay.
Population of about 1.1 million people and 3 big acute hospitals. And having 3 big acute hospitals, i.e. the Royal Infirmary, the Glenfield and the General, you'd think is a benefit, but it's not. It's a drawback because we're spreading our staff, we're spreading our specialist equipment too thinly, and we're also pinging patients around those hospitals for different parts of their clinical care, which is annoying for patients. So by consolidating onto essentially the Leicester Royal Infirmary and the Glenfield site, it means we can put all the services that need to be together and next to one another together, as well as focus the staff together. And that's really important for kind of modern clinical care. You can't do it from different outposts dotted around the city as effectively as you can if you consolidate it. And that's really at the heart of why we're trying to do this. As I said at the start in the intro, in general, the care we deliver, I think, is really pretty good. We don't get it right all the time, we know that, but it's pretty good. And our clinical outcomes, our survival rates on things like cancers are really, really very good. But actually, the buildings from which we operate are knackered, and it doesn't make it easy for our clinical staff, and we'd like to make that a bit easier, whilst at the same time giving patients the kind of environment that puts them at their ease.
Real good point. Good point.
Because Attraction, when we look at our hospitals, we want them to be the best of the best, right?
Yeah, of course.
Yeah? And this is what you're kind of proposing and why the change is needed, right, Mark?
Yeah, and actually, if you're a football fan, and I hope I'm not going to insult anybody, that it's not just about the buildings, but it's significant. And what I mean by that is, so anybody who's an Arsenal fan will know that, you know, a few years ago they moved to the Emirates Stadium, but actually they haven't really won anything.
Yeah.
So just having fancy buildings is not the be all and end all of it. But if you've got really good services and good buildings alongside, then that's a bit of a dream ticket. So that's what we're heading for. It's not just going to build posh buildings. It's
And this proposal, right? There's 450 million pounds, which is a really huge sum out there. You know, it's like nearly $500 million. Near enough. So where's the money coming from? You know, that's a lot of money, right? Attraction.
Yeah, a lot of money.
A lot of money.
And also as well, how they're going to get the nurses and the doctors to support all this as well.
So and I know it's a double whammy question, Mark. As you know, us on EAVA, we love to send 2 questions. And just to add on that, wouldn't it be better just to employ lots of doctors and nurses in the current 3 acute hospitals rather than, you know, so where's the money coming from? So that's really the question, you know? Yeah,
well, that's the first question that people was putting to me, saying, where's all this money coming from?
Well, you've squeezed 3 questions into that one, haven't you? If I start with where the money's coming from, so it's coming from government, which we're stoked about. You know, we're entirely pleased by that. There are, in terms of what the government's intending to spend on the NHS, there are 6 hospitals up and down the country that have been chosen in the first wave for reconfiguration, and we're one of that 6.
Okay.
So there's no strings attached to it. It's not a kind of a fancy mortgage that we've got to repay. It's just straight out of Treasury and straight into building. So that's where that's coming from.
I kind of like how you said there's no strings attached, and we don't have to pay this huge lump sum back, you know.
No.
Which is fantastic. So this is why the proposal has been put forward, and the money has come 450 million. Okay.
Yeah. The way the government used to do it a few years ago is they would essentially, through something called PFI, which is private finance initiatives, they would essentially loan you the money and then you pay it back at kind of mortgage-like rates, and we're glad to see the end of that.
Perfect.
In terms of so that's where the money is coming from. Why wouldn't we spend it on doctors and nurses? Well, I mean, it's a really good question for a start. Where shall I start on that? People think that the reason why the NHS doesn't have enough doctors and nurses is it doesn't have enough money to pay for them, and actually that's not really the case. So I'll give you an example from Leicester.
Yeah.
So we currently have about 420 nurses fewer than we would like to have. Okay. We've got the money to pay for those nurses.
Okay.
But they're not coming out of training, and it's the same with lots of doctors and lots of specialisms. There just simply aren't enough nurses going through training or doctors going through training to fully staff the NHS. So it's not a money issue; it's a training issue. So, as an example, we take all of De Montfort University's nurses and midwives from their yearly intake, and we keep most of them in Leicester, but they still don't quite get us to where we need to do. Which is why you hear about the NHS looking for nurses and doctors to come in from overseas, because that's broadly the only place we can find them at the moment. Okay. It's not a money issue. in terms of why we wouldn't, even if those nurses and doctors existed, would we spend all the cash on recruiting more of them? Probably not, for the reasons I've explained. Is that one of the easiest ways to kind of make it so we don't need quite so many, we don't always have a gap of 400, is to get our doctors and nurses working more cleverly together in 2 big hospitals rather than 3 big hospitals.
Right.
So by consolidating onto the Royal and the Glenfield sites, it means it's an awful lot easier to kind of plan our rotas, to plan our shifts, make sure that wards are properly staffed at all times. Does that make sense?
Yes, it does. It does.
Definitely makes sense, right? Attraction.
Is there a third question that I've missed?
No, you haven't. No, you haven't. You answered everything. You've definitely, gave us a good insight of what you think.
Yeah, because all the time we've always the biggest question a lot of people ask, especially us at the radio, is where's the money coming from, and why ain't they doing this? Why ain't they doing it? And I think you've kind of said that, and I just want to reiterate to the listeners is, the money, there's no strings attached. We're not going to be paying this lump sum back. It's coming. It's ours, and the proposals are there.
Yeah.
So we are telling the listeners, look, this is your chance to say what your opinion is on this, right?
Yeah, definitely. Because on the manual, there's questions on there that people, if they want to propose something or put something to the NHS, they can do.
Yeah. On the questionnaire. Yeah.
On the questionnaire.
Yeah.
All this proposal now, Mark, won't it, how is it going to affect parking? Because when it comes to the hospital and parking and stuff like that, especially at the Leicester Royal Infirmary, it's kind of difficult. So how is this going to make things better?
Okay, another good question. I should have expected that.
Because one of the things, Mark, we're going to have a huge maternity with children, and that's going to attract more people. I'm guessing, there's going to be more people, more cars. That means,
yeah.
Go on, I'll let you answer.
You'd be guessing, but you'd be off the mark in terms of your guess. So remember when I told you at the start that we're essentially building another hospital at the Glenfield. So next to the existing Glenfield hospital will be another hospital, which is the treatment centre.
Yeah.
That will take about half of the patients that currently come to the Royal Infirmary and the general sites. So give you a sense of the scale of what we do in your local NHS. So we see about 1.1 million patients a year, and about 700,000 of those patients are seen at the Royal Infirmary. When we've done this reconfiguration, when we've kind of put the last brick in place, half of those patients will no longer be seen at the Royal Infirmary, they'll be seen at the Glenfield.
Right.
So the Royal Infirmary gets a lot more space, doesn't need as much parking. The Glenfield, on the other hand, will need more parking, but the beauty about the Glenfield site is actually it's not as crammed in as the Royal Infirmary, because it's not right in the middle of the city. So we'll build extra car parks up at the Glenfield site, and that will ease the parking issues.
Okay.
Would any of the other hospitals be closing? Like, because there's rumours going around that the General was going to shut as well.
So the General isn't going to shut, but it won't any longer be what we call an acute hospital. And what I mean by that is an acute hospital in NHS jargon is a hospital that has overnight beds for patients, and it admits emergency patients. So rather than doing that, because as I said, all those services, the emergency and the specialist services, will move to the Glenfield and the Royal. So they're all as close together as they can be, rather than spread out too thinly across the city. That means the General has a different future, and that becomes subject to this consultation, kind of community healthcare campus for the city. Essentially what that means is that it will do a lot of the work that GPs currently do,
right,
at a larger scale. So we'll expect GP practices to move into the General Hospital, and they will have access to all our fancy imaging and diagnostic equipment. So it means that a GP, rather than seeing a patient in their surgery and then having them to refer them into hospital for an X-ray or a CT scan, can just send them next door to the imaging section. And that means that they can do so much more in the community than they can do at the moment, which is entirely the right thing to do, because frankly, there's lots of work that goes on in NHS hospitals nowadays that probably could be done elsewhere, closer to where people live, rather than having to take buses, cabs, drive in, all that kind of stuff. They can probably have that work done closer to home. So we're pretty excited by that as well.
It's all about the conveniency of how things and how quick you can get things done on an easier scale.
It's that, yeah, it's convenient, more convenient for the patients, we think, but also it means that the big specialist hospitals, which we are, can focus on doing the specialist and emergency work, which is what we're here to do, really.
So in terms of general, will that, when you say it'll be like a GP practice, will a lot of patients be going there for their GP consultation as well, or no, or how does that work? What's being proposed there?
Okay, so sorry, I should have been more specific, Vijay. I'm sorry, but so there'll be what we're calling a primary care hub, which again is NHS jargon for a goodly amount of GPs with access to on-site imaging and diagnostics, which is something they don't have at the moment. So that's part of it, a primary care hub. At the same time, the general hospital will still retain the Diabetes Centre of Excellence.
Yes.
So this is the big diabetes research unit.
They're doing fantastic.
It does some really good work, and there's a lot of diabetes in our communities in Leicester, as you probably know. So it's really important work that they do for patients and for research into diabetes and prevention. It will have, the general will also have the Evington Stroke Unit, and that's where patients who have been stabilised, they've been saved from the worst effects of their stroke, but they need time to rehabilitate. They'll rehabilitate at the general in the stroke rehab unit, which is a good thing. And it will also have, subject to whether the public tell us they want this, a midwife-led birthing unit, which is essentially a kind of a standalone place for mums to give birth who don't want to do it on a big hospital site.
Right.
That makes sense.
Yeah. It makes perfectly good sense.
Definitely. In terms of the changes and the proposals being made, I do have one more final question. I just to let you know, Mark, I don't want to take too much of your time, but we are going to a break at prompt at 6:30. So these proposals, we want people to go to www.betterhospitalsleicester.nhs.uk and fill out the questionnaire of what the proposed plans are. Or also you can call the number 0116 295 0750, and then you can order a paper copy, etc. But also my other question that I've got for you is, when you collect all the data and everything's all the proposal, what's going to happen with all the community feedback?
We're going to read it and think about it, and then see whether it alters our plans.
Yeah, and then when will that decision be made? Because I know the consultation finishes on the 21st of December.
Yeah.
Will the findings be published out there? What the community thinks?
So all the results and the feedback we get from not just the city of Leicester, but Leicestershire and Rutland. Remember, we serve all those geographies. Yeah, all that will be put in the public domain and published. We'll then have a think about what it means to us. Have we missed anything? Is there something that we haven't thought of, or something that doesn't quite work for people? And then at the end of that, we'll come back to people and say, okay, so this is what you said, this is what we've done, and this is what we'd like to do next. And then hopefully get on with the building.
So for me personally, I take my grandparents to hospital quite often, or family members, etc. And the biggest thing that I always have to do is sometimes go to the Glenfield for x-rays, take them to the surgery for blood tests.
Yeah, that's right.
And then for CT scans or any scanning, we have to go Royal.
Yeah.
Or for this, for instance, the eye clinic in Royal Infirmary, we have to go there. And it's like going so many different places on a regular basis. So now this way with the general, Yeah, we've got 2 minutes left. So the general will be one where we can just take them there, one place, and everything's going to be there, right?
So, I mean, as I said at the start, you're better at doing this than I am. So, essentially, yeah, we're trying to get the right services next to one another. Yeah. So, our doctors and nurses are together because that togetherness breeds spirit and culture, but also enhances learning and education and research.
Yeah,
and at the same time, stop pinging patients around the city with different parts of their care.
Absolutely.
I think that's it gets very frustrating for patients and for you guys as well. You know, for the staff at NHS as well. But there's nothing right now that can potentially happen because everything the way it is built and everything. Yeah, we've just had a listener saying excellent, very informative. So Mark, really thank you. You know, I think we've covered everything. So me and Attraction are going to talk after the adverts. We've got literally 30 seconds. Is there any final words you'd like to say?
I just once again thank you for letting me on and encourage people to take part in this because it's your NHS. It's not our NHS. We just look after it.
Yeah. Thank you very much. Thanks for your time, Mark.
Okay. Thanks, Jen. Take care. Stay safe.
Thank you very much. You too.
Bye. So yeah, Attraction, we're going to go into the commercials and we can have a little chat straight after.
Yeah.
So here we go, people. But, you know.
It's been really informative. Open your mind. Hopefully people out there will have a better.
EAVA, sharing the richness of cultures. This is EAVA FM.
Metal is amazing. It can transform itself into pretty much anything, from a tiny little can to a phone, computer, or even another little can. Metal is a valuable resource for our city and is endlessly recyclable. So when you finish with your food and drink cans, aerosols and foil, give it a quick rinse and drop it into your orange recycling bag or recycling bin. It's as easy as that. Visit leicester.gov.uk/recycling. Go on, keep recycling for Leicester and make your metals matter.
This is EAVA FM.
This is an important update about coronavirus. To help save lives, new national restrictions are now in place until the 2nd of December. You must stay at home. Only leave home for food, medical reasons, exercise, education, or work. You must work from home if you can and avoid travel unless essential. Go to gov.uk/coronavirus for latest guidance and exemptions. Stay alert. Control the virus. Save lives.
EAVA FM.
As winter approaches, here's a critical reminder of coronavirus symptoms from Dr. Gupta.
The main symptoms of coronavirus are a high temperature or a new continuous cough or a sudden loss or change in your sense of smell or taste. If you have any of these, to protect yourself and others, it is critical you isolate at home, even if you don't feel too bad. And you must book a test immediately. Use the NHS COVID-19 app or go to gov.uk/coronavirus.
Stay alert. Control the virus. Save lives.
EAVA FM.
Just the flu, people say every year. But in an average year, the flu kills 11,000 people and hospitalises tens of thousands more. There's no just about it. Flu is a virus that can cause serious complications. That's why we offer you the flu vaccine free. It's your very best protection. Ask your pharmacist or GP if you're eligible for the free flu vaccine. NHS. To protect against flu, help us help you.
Serving the community 24 hours a day. EAVA FM.
Businesses. Want to keep your business moving? Then you need to get a move on. From the 1st of Jan next year, if you deal with Europe, you've got new rules to follow. Time is running out. So get on it at gov.uk/transition. New rules for business. Large, micro, one-man band. New rules are coming no matter what. Get it done today at gov.uk/transition. Check, change, go.
EAVA FM is a multilingual radio station serving the diverse communities of Leicester on 102.5 FM. For advertising and sponsorship, email sales@eavafm.com or call 07811 659 364. That's 07811 659 364. Serving the community, 102.5 EVA FM.
But on the opposite side of those, and the time now is 6:33, and myself and VJ is still here. What did you find to what Mark was saying?
Well, a lot of things have been proposed. A lot of things have been
of things
being proposed. I think yes, I'm definitely. I need to go to the website www.Better Hospitals Leicester NHS. I filled out the survey and I really
did I, and I sent mine back.
Yeah, I've sent it back. I think the changes they're going to make to the general, I'm for, but I don't know how exactly it's going to work. Glenfield making it bigger, yes, definitely. I'm definitely loving the idea of that, and that should definitely go ahead as well.
Well, the big thing for me, is that the buildings are having a refurb.
Yes,
that's the main thing, because we want to go into a hospital looking nice.
Yeah,
like I said, I've been out of town and I've looked at other people's hospitals, and it's pretty good. So I think Leicester's below standard when it comes to the look.
Yeah.
You know what I mean? So that's a good thing.
And when Mark said some of our buildings are 250 years old,
wow, that hit home. That definitely hit home. So we definitely, I'm kind of glad that Leicester's been picked as one of the six.
Yeah,
to get this refurb. And it like I said, we have to embrace change. You know what I mean? Building up a city, because if you look around Leicester, personally, Leicester is getting built up.
Yeah. We've seen a lot happen.
So why not the hospitals?
And the other thing, right? This is our opportunity as a community to have a voice.
Of course.
Because a lot of the times, a lot of things happen in our city, and us, the community, say, why weren't we consulted? Why weren't we asked the question? So now I'm kind of saying to all the listeners, me and you, we're in media. We get all the info on our email.
Yeah, that's right.
Right, Attraction.
Yeah.
Your inbox is full of everything that happens in Leicester. Either because you're part of the entity, you're part of the radio, and we're part of radio, and you've been doing it for years and years and years.
That's right.
Myself as well. It sits in our inbox, and we probably know more than a lot of the community.
That's right.
But however, this whole campaign that the NHS has been doing, it's been fantastic. Facebook, Instagram, EVA FM, the other radio stations, certain TV channels. So
they're getting it out there. That's the main thing. But there's still, like I said, there's still a lot of people that needs to know what's going on, and day by day, people are finding out.
Absolutely. So we as a community have got till the 21st of December to kind of give our opinions, whether they're negative or positive. You know what I'm saying? Because not everything, even myself, I wasn't just saying yes to everything. I was like, yeah, but what about this? As Mark said, maybe we've missed something as the NHS.
Yeah. Well, you know what? It's like anything. Whenever you're building a structure, you're going to miss things out, and you're going to have to go back and think, okay, we can change this.
Yes.
Or make this a little better. You know what I mean? But when you talk about the amount of money that's been thrown into this project, a lot of people say it still ain't a lot.
Yeah.
That's another thing as well that I like to put out there to the NHS as well. Even though it sounds a lot, between 3 buildings, it ain't a lot.
Yeah. And the NHS, like, I think it was one of the guests mentioned in one of the other shows that 2 million gets spent every day in Leicester hospitals. That was the budget, around 2 million.
Wow.
Yeah. So we got to imagine, to keep all the staff, everybody running, all of that. So the size, and I think, like you said, it hits home when we're going to have new buildings. I love how Mark put it, when you have a nice stadium, etc. It's not all about that, but it does help.
Yes, of course it does. You know what I mean?
The NHS do a great job here.
Yeah. Well, that's an understatement there, because obviously when it comes to the NHS, they do fantastic work.
Yeah.
But it's better for the nurses to have better surroundings for them to do better. And then you might get more people wanting to come and work there as well.
Yes.
Because it's,
Yes.
good environment brings good people as well at the same time.
This is why I enjoy talking to you, Attraction, because we can really reason.
Yeah.
This is real reason. If you've got a good environment, you want to stay there.
Exactly.
Yeah. If you know, right, I'm going to go to this building, it's all broken down, it's so and so,
and it's cold and it's broken. And do you want to get up to go to that particular place?
This is why you love EAVA, isn't it? This is why we love it here.
Yeah.
Even me, I wouldn't go because I love the building.
Yeah, the building's lovely. You know what I mean?
I couldn't go.
And that is an important part of, with the NHS, When it comes to like yourself, like you were saying that you take your people to the doctors, I know there's a lot of people out there that are looking after the elderly as well.
Yes.
So, this could be a good thing for the elderly because obviously when they go in there, they need assistance.
And rather than taking them to one place to another place, this is
if it's all in one place where it's all connected, with like connecting the dots, it can only be a good thing. You will want to go to the hospital. You will want to take them, and you will want, because you know that you're going to be sitting there, you're going to be comfortable. You're not going to be dashing from one place to another place. And that's basically, it does work. And when it comes to the parking as well, because that's been a bit of a nightmare. Seriously, because I myself have been, going to the hospital as well. I know that my niece is, she suffers with certain allergies and stuff like that. And when you take them and you got to pull a ticket, park fine where you, sometimes it depends on what time of,
especially in the
evening. Yeah, exactly. You know what I mean? So that can be of a bit of a thing. But if this new structure that they've putting into place, and it can expand on the car park, then
the proposal sounds good.
It definitely sounds good.
You know what, Attraction? Thank you so much. Of course, on your show, I know you love new music.
Of course.
Yeah, you're the new music man, and
you know what? It's all about promoting music. That's what it is for me.
But for you to be doing this NHS on your show, and getting the message out there, and I know you love the community.
Well, you know what? I'm a community person, right? No matter what, I might love my music, but at the same time, I've always done things for Leicester. Okay. From when I was starting from sound system, I've always looked about my community, and that's what it's about. I'm pretty sure it's been the same for you.
Yes,
as well.
Absolutely. I've learned from people like you. So it's good. You know what I mean? But yeah, Attraction. We just want people to check out the proposal, fill out the online questionnaire. Here it is. I'm holding one there. This is a paper version.
Yeah.
But the online version, is coming soon as well.
Which camera?
The online version. Go to the online version, www.betterhospitalsleicester.nhs.uk. And if anybody struggles filling anything out or accessing it, 0116 29 50 750.
Also, as well, VJ, where can these people get these?
They can request it. We've got a load as well at EAVA FM.
Yeah, because I've been giving out a load of things.
So that's the leaflet you have there with all the information on. But there's also this booklet with the actual questionnaire on. So there's two. You can get all of these from anywhere. If you ring the number, they'll get posted out to you. That you can contact people anywhere. So again, 0116 29 50 750. You can go to the website. I'll be putting a lot of stuff up on the EAVA FM and platforms. We're going to have the videos on YouTube.
Yeah, definitely. So that the message is constantly out there. Because
and our deadline is the 21st of December to have our say.
Yeah. And that's very important. What I mean? Very important, because there's a lot of people, like I said, didn't know, but they are getting to know now through the radio station and the website and social media. you know, and it's a good thing. It's a good thing.
Okay. So yeah, just want to say thank you to all the listeners and thank you to Mark as well. I know Attraction's going to carry on with his show till 10 p.m. today.
Yeah. Well, I don't start that program until officially after 7
But you're going to start straight away. But you can still carry on listening to us on 102.5. We're going to be logging out the live feeds, however. So we're just going to say goodbye to everyone. Take care. Here we go.
Stay safe.
Stay safe. And remember, building better hospitals, Leicester. Here we go. What you got for us, Attraction? In fact,
let me just play some music.